we're fortunate enough to see 2050. I think that graphic right there shows you why tonight's show is important. To start us off, Dr. James, call me Jim, Kimmy, we appreciate you being here, Executive in Residence from the Department of Health and Management Policy at St. Louis University. I guess we should start maybe with some definitions. Who is a senior? What is there? How is that defined?
That's probably the toughest question you're going to ask, because the definition changes over time and it depends on what factors you're going to use. Age, everyone thinks age. 65 is senior. 50, AARP thinks you're senior and they'll send you some promotional material.
That's too young.
But there are also social factors, cultural factors, medical factors, physiological factors. So who's a senior, you can't really define with numbers. Every case is individual.
So if that's kind of changing, are the issues changing? Do you consider yourself a senior?
Oh yes, I'm very senior.
Okay, fair enough. Congratulations. But this is an issue that you've been working on long before anyone would have called you a senior, I believe.
Yeah, that's true.
So tell me how you've seen that change.
Well, you know, to say how long I've been working on it, I remember when Medicare and Medicaid were passed, so I've been working on it for
about 45 years ago.
About 45 years ago. And I think what's changed over time, many things have. You cited one when you talked to your parents, Facebook and Twitter.
Right.
Social media has brought some change, but that's at this end of it. At the other end of it has been the opportunity for people to get coverage that they didn't have before Medicare. Medicare has changed itself. It's covering a lot more people than anyone ever thought it would when they set the program up. We have an aging population, so that there's going to be a bulge even bigger in Medicare. So what's really changed the most, I think, is cost of all of this. And it's not cost of the programs as much as the cost of health care, of medical care. We've seen that, you know, we've had a lot of technology, a lot of technological advances. We have a tendency in this country to say because we can, we must. And so we use a lot of technology. It's very expensive, and it drives up insurance costs, it drives up the cost to individuals, it drives up the cost to the government. So we're in a spiral, and it's an upward spiral, and it's a dangerous spiral. At the rate we're going, if you project out, say, 20 years, 100% of the gross national product will go to health care. Now think about that. That means no balance of payment problems. It means no international relations problems, because we got either you're going to be sick or you're going to be taking care of the sick. Now that's impractical. So things have got to change. We've got to get control of the prices for health care, and we've got to get health care to more people. Probably the biggest change, other than the Medicare program, has been the Affordable Care Act. And the Affordable Care Act is providing an opportunity, not the one I would have wanted necessarily, or not as broad as I might have wanted, but it provides the opportunity for millions of people who have not had access to insurance. But I think right now we're at the best place we've been in those 45 years.
Well, that's encouraging to hear. Let's kind of move to the individual. What should the individual be thinking about as they are moving into the senior range?
Well, there are a lot of things to think about. I think, you know, the thrust tonight is to think about medical care and how you get access to it. I think probably more important as you move into this area is what's my social life's probably not the right term, but how am I going to live? How am I going to cope? What kinds of things am I going to do to stay alert, keep active? Those are really important. What kind of preventive programs can I take part in? What will I do to keep myself healthy? Because health is probably the thing that people in this population need the most and value the most. And so I think that's a very important issue for them.
When should you be thinking about these things? Can I say
kindergarten? Kindergarten.
Okay, there you go.
Yeah, kindergarten. You know, there are a lot of things that we don't do very well. You know, this is a very obese country. We have obese children. We have obese adults, and that adds to the costs of the system. But I don't worry so much about the adding to costs. It adds to mortality and morbidity. It hits the quality of life, and I think that's the critical issue.
Okay, so if AARP says 50, let's just use that number. How much do people over 50 really know about their health care and what's ahead?
Not a heck of a lot. You know, every survey that's done just shows abysmal ignorance about what's going on in health care, what the opportunities are in the Affordable Care Act, What's going to happen to Medicare as a result of the affordable? All of those kinds of questions come up, and people just don't know the answer. Now, one of the problems is, and probably the biggest problem for the older population is, they have been subjected to the biggest bunch of bull in terms of disinformation about this legislation. They've gotten disinformation from political parties, they've gotten disinformation from people who make a profit from healthcare. And so where do they turn to get good information? Who do they believe?
Stay tuned, I hope.
Well, that's I hope the setup for the evening.
Okay.